Thank you for joining the Virtual Nursing Pilot Project. You're helping pioneer virtual care for patients and healthcare workers in crisis. Imagine you're a nurse in a New York hospital. You're caring for 10 sick COVID patients. Every alarm in your assignment is ringing constantly because there's no one there to help and visitors are not allowed. Now, instead of being alone, imagine you have a virtual nurse buddy who might be working from home, from a neighboring hospital, or from a virtual healthcare center. The goal of this project is to turn an on-site physical nurse into a super nurse. We don't want them charting or typing on their computer. We want them hands-on, taking care of patients. The virtual nurse is going to be a scribe, but they'll also be video calling into patients' rooms and providing virtual nursing care. They can check vital signs, chart, organize care, follow up on results, and be a sympathetic ear for patients, all the while keeping the physical nurse in the loop. Signal is the secure messaging app that you will be using for communication. It is set up so that messages are deleted 1 hour after they are sent. The voice memo button is the most important tool for the physical nurse. Use this to send messages to your virtual nurse scribe. Need to chart? Press the button. Room 12, David Smith, 3 p.m. 22-gauge IV dorsum left hand. Needs an extra blanket, a sandwich, and a commode. Once the virtual nurse charts it and contacts the care aide, they send back a thumbs up to complete the loop. Are you ready to get started? Let's go over your equipment. The physical nurse has both a mobile phone in their pocket and a tablet at their workstation. Most communication should flow to the mobile device, but pictures of charts will be sent to the tablet for easy viewing and printing. Each patient has a device in their room. Our virtual nurse will have 1 or 2 tablets and can also use a laptop to make typing and texting easier. To make a video call, open Signal, select the person, press Video Call, and when the person answers, tell them to tap the video icon in the top corner of their screen so you can see them. Now, let's go over some workflow suggestions. If the physical nurse is available at the start of check-in, they enter the room, do the ABC assessment, and then teach the patient how to call the virtual nurse. While the virtual nurse takes the history, the physical nurse connects the monitors, starts the IV, and gets ready to leave the room. Before leaving, the physical nurse confirms the patient is able to answer the phone without assistance and teaches them to text or voice memo for all non-urgent requests. The physical nurse leaves the room and the virtual nurse finishes the check-in. Once they've done all the charting, they take a photo of the chart and send it to the physical nurse's tablet. If at the start of check-in, the physical nurse is not available, the virtual nurse can try calling the patient directly, and if they're not able to answer, then a care aide can be sent into the room. The virtual nurse calls the patient, then has the patient point the camera at the monitors so that vitals can be recorded. For unmonitored patients, there are some patient-friendly pulse oximeters and blood pressure devices that can be provided to the patient. If the patient's unable to operate the device independently, then a care aide can go into the room and facilitate the video call. After an intervention is done, the physical nurse can send a voice memo or text. Bed 16, patient John Smith, Foley catheter inserted, no complications, 200 cc's of yellow urine, sample sent for CNS 3 p.m. When the physical nurse notices allied health interventions, like lab, ECG, or imaging, they'll send a text or voice memo so that it can be charted. When new orders appear on the chart, the physical nurse needs to send a picture to the virtual nurse and a voice memo indicating what has already been done and if any help is needed, such as order entry. For certain interventions, pictures might be faster than a voice memo or text. For example, routine vitals can be documented by sending a picture of the patient's wristband and a picture of the monitor screen. For every intervention, once it's charted, the virtual nurse sends back a thumbs up to close the loop. At regular intervals, the virtual nurse will send pictures of the most up-to-date chart to the physical nurse's tablet. The virtual nurse will check lab and imaging results if possible, and update the physical nurse by text for urgent issues or by updating the chart for non-urgent issues. Congratulations! You are now ready for virtual nursing. For improved efficiency, try and avoid the trap of having the virtual nurse listening to the physical nurse talking to the patient. Instead, have the nurses work independently and use voice memos, text, and quick calls for charting, requests, and updates. Thank you, and stay safe.